Hello future nurses, welcome to a crucial topic you'll encounter every single day in your practice. We're talking about nutrition, a cornerstone of health that when imbalanced can lead to complex and challenging conditions. As you prepare for the NCLEX and your future career, understanding nutritional disorders is not just about memorizing facts, it's about grasping patient wellness and disease. Think of the human body as a highly sophisticated machine. What you put into it for fuel directly impacts its performance, its longevity, and its ability to repair itself. When that fuel is excessive, insufficient, or of poor quality, the system begins to malfunction, leading to the conditions we will explore today. When we talk about obesity, it's critical to move beyond the simple idea of someone being overweight. From a clinical perspective, obesity is defined as a complex and chronic medical condition characterized by an excessive accumulation of body fat to the extent that it may have a negative effect on health. This isn't a cosmetic issue or a matter of willpower. It is a disease with significant physiological and psychological components. The World Health Organization and other major health bodies classify it as such because of its clear association with a host of other chronic illnesses: type 2 diabetes, heart disease, certain cancers, and osteoarthritis. Let's put this into context with a patient you might encounter. Consider a 55-year-old man admitted for knee replacement surgery. His chart notes a body mass index or BMI of 38. This number immediately tells you he is living with class 2 obesity. For him, this isn't just a number, it means he likely experiences daily joint pain, shortness of breath with minimal exertion, and may already be managing conditions like hypertension and high cholesterol. His excess body fat is not just stored energy, it's an active endocrine organ that is secreting inflammatory markers, contributing to a state of chronic, low-grade inflammation throughout his body, which can complicate his surgical recovery and long-term health. The manifestations or the signs and symptoms of obesity are varied and can affect nearly every body system. Visually, you might observe a large body frame and a high waist-to-hip ratio, but the internal signs are just as important. A patient might report fatigue, joint pain, especially in weight-bearing joints like the knees and hips, and difficulty with breathing, sometimes diagnosed as obstructive sleep apnea. You might also note skin issues in body folds, such as rashes or fungal infections due to moisture and friction. Ultimately, the goal of care for a patient with obesity is not just about losing weight. It is about improving overall health and reducing the risk of comorbidities. Specific, measurable, achievable, relevant, time-bound. For instance, a realistic goal might be a 5 to 10% reduction in total body weight over 6 months, which has been shown to significantly improve blood pressure, blood glucose levels, and cholesterol profiles. Another goal could be to increase physical activity to 150 minutes per week. These goals shift the focus from an abstract number on a scale to concrete health improvements. Let's discuss non-pharmacological management of obesity. Moderate intensity activities include brisk walking, water aerobics, ballroom dancing, and general gardening. Vigorous intensity activities are jogging or running, swimming laps, jumping rope, and fast bicycling. Muscle strengthening activities include weightlifting, using resistance bands, body weight exercises, and yoga. For extremely obese clients, surgical management may be considered. Bariatric surgery is the main surgical treatment for those with a BMI over 40. There are 3 main types: restrictive surgeries, which reduce stomach size, malabsorption procedures, which interfere with nutrient absorption, and combination surgeries like gastric bypass. Post-surgical complications include anastomotic leaks, nutritional deficiencies, dehydration, and dumping syndrome. Watch for symptoms like increasing back or abdominal pain, restlessness, tachycardia, and oliguria. Dumping syndrome causes nausea, bloating, abdominal pain, weakness, sweating, and even fainting after eating. Discharge teaching includes a diet and exercise regimen, nutritional supplements, hydration plan, and recognizing signs of infection or complications. Patients may also need support for psychological or body image issues. To truly understand obesity, look under the hood at pathophysiology. It's what happens inside the body. Obesity equals a long-term energy imbalance. Calorie intake exceeds energy expenditure. It's more than eating too much and moving too little. Adipose tissue isn't just passive. It's an endocrine organ. It releases hormones and cytokines. Leptin, adiponectin, tumor necrosis factor alpha. Excess visceral fat surrounds internal organs. That drives chronic inflammation and causes insulin resistance. Causes are multifactorial: genetic factors, environmental factors, behavioral factors. Some people have a thrifty genetic blueprint, but genes aren't destiny. Obesogenic environment, high-calorie processed foods, sedentary lifestyle, social determinants, low income, limited access to healthy food, food deserts, lack of safe spaces for physical activity. Insulin normally unlocks cells to let glucose in. In obesity, inflammatory substances block that. Cells become insulin resistant. The pancreas overproduces insulin. Hyperinsulinemia, hyperglycemia. This is a pathway to type 2 diabetes. Behavior and psychology matter: stress, emotions, depression, anxiety. For some, food becomes a coping mechanism. Medications can cause weight gain: antidepressants, steroids, antipsychotics, hormonal disorders, hypothyroidism, Cushing's syndrome. As a nurse, assess genetics, cellular function, socioeconomic status, and mental health to get the full picture. Now let's shift our focus to metabolic syndrome, a condition intimately linked with obesity but distinct in its definition. Metabolic syndrome is not a single disease but a cluster of 5 specific risk factors that, when present together, dramatically increase a person's risk for developing cardiovascular disease, type 2 diabetes, stroke. Think of it as a perfect storm of metabolic abnormalities. The presence of just one of these factors is a concern, but when a patient has 3 or more, they officially meet the criteria for metabolic syndrome and their risk profile skyrockets. This synergy is what makes the syndrome so dangerous. The 5 criteria for metabolic syndrome are critical to memorize for the NCLEX and for your clinical practice. Let's break them down using the mnemonic WHILI-GLU-PRE that stands for waist, HDL, lipids, glucose, pressure. First is waist, a large waist circumference indicating abdominal obesity, greater than 40 inches for men, 35 inches for women. Second is HDL, low levels of high-density lipoprotein, the good cholesterol, less than 40 milligrams per deciliter for men, less than 50 for women. Third is lipids, high levels of triglycerides, 150 milligrams per deciliter or higher. Fourth is glucose, elevated fasting blood glucose, 100 milligrams per deciliter or higher. Fifth is pressure, high blood pressure, 130/85 millimeters of mercury or higher, or currently on medication for hypertension. Imagine your patient, Mr. Smith, a 60-year-old male. During your morning assessment, you note his blood pressure is 140/90 millimeters of mercury. You look at his lab results and see his fasting glucose is 110 milligrams per deciliter. His triglycerides are 200 milligrams per deciliter. His HDL is 35 milligrams per deciliter. He already meets 4 of the 5 criteria. Even if his BMI is only slightly elevated, this cluster of findings places him in a very high-risk category for a future heart attack, stroke. This is a classic presentation of metabolic syndrome. Your ability to connect these seemingly separate data points into one cohesive diagnosis is a key nursing skill. The primary goal of care for a patient with metabolic syndrome is aggressive risk reduction. This means tackling each of the components of the syndrome simultaneously. The overarching aim is to prevent the progression to full-blown type 2 diabetes and to reduce the likelihood of a major cardiovascular event. This is achieved through a 2-pronged approach: intensive lifestyle modifications and, when necessary, medical management of each individual risk factor. Your role as a nurse is central to coordinating this care, providing education, and motivating the patient to adhere to a complex treatment regimen that will require significant changes to their daily life. The pathophysiology of metabolic syndrome is a complex cascade of dysfunction. It begins in most cases with central obesity and the resulting insulin resistance. As we discussed with obesity, the visceral fat cells are metabolically active and release inflammatory cytokines. These substances travel throughout the body and directly interfere with insulin's ability to do its job. This insulin resistance is the central pillar upon which metabolic syndrome is built. The body's cells are starving for glucose even though there's plenty of it in the bloodstream. The pancreas responds by producing even more insulin, leading to hyperinsulinemia. This state of insulin resistance and hyperinsulinemia has several downstream effects that explain the other components of the syndrome. For example, high insulin levels affect the kidneys. causing them to retain sodium and water, which contributes to increased blood volume and high blood pressure. Insulin resistance in the liver leads to an overproduction of triglycerides and a decrease in the production of HDL cholesterol, explaining the characteristic lipid abnormalities, high triglycerides and low HDL. The constantly elevated blood glucose from insulin resistance directly damages the lining of blood vessels, a process called endothelial dysfunction, setting the stage for atherosclerosis. The potential complications of untreated metabolic syndrome are severe and life-altering. The most significant is a drastically increased risk of cardiovascular disease. The combination of high blood pressure, abnormal lipids, and high glucose creates the perfect environment for atherosclerosis, the buildup of plaque in the arteries. This can lead to coronary artery disease, heart attacks, and strokes. Individuals with metabolic syndrome are about twice as likely to develop cardiovascular disease compared to those without the syndrome. Beyond cardiovascular issues, the most common complication is the progression to type 2 diabetes. The pancreas cannot sustain its high level of insulin output forever. Over time, the insulin-producing beta cells in the pancreas become exhausted and start to fail, a condition known as beta cell dysfunction, when the pancreas can no longer produce enough insulin to overcome the body's resistance. Fasting blood glucose levels rise even higher, and the patient crosses the threshold from prediabetes to type 2 diabetes. Other complications include non-alcoholic fatty liver disease, or NAFLD, which can progress to cirrhosis and chronic kidney disease. The management of metabolic syndrome is aggressive and multifaceted, with lifestyle modification being the absolute first-line therapy. The primary goal is weight loss, specifically targeting the reduction of visceral fat. A modest weight loss of 7 to 10% of body weight can produce dramatic improvements in all components of the syndrome. As a nurse, you will be the key educator, helping the patient create a realistic plan. This includes counseling on a heart-healthy diet, DASH diet, Mediterranean diet, low in saturated fats, low in trans fats, low in sodium, and rich in fiber, fruits, and vegetables. You'll also work with the patient to develop an exercise plan, aiming for at least 30 minutes of moderate intensity activity most days of the week. In addition to diet and exercise, other non-pharmacological interventions are crucial. Smoking cessation is paramount. Smoking independently increases the risk of cardiovascular disease and worsens endothelial dysfunction. Stress management techniques can also be beneficial. Mindfulness, yoga, deep breathing exercises. Chronic stress can contribute to elevated cortisol levels, which can worsen insulin resistance and blood pressure. Adequate sleep is another important component. Poor sleep and conditions like sleep apnea are linked to worsening metabolic health. While our society often focuses on the problems of excess, it's equally important for nurses to recognize the pervasive and often hidden problem of adult malnutrition. Malnutrition is a state of nutrition in which a deficiency, excess, imbalance of energy, protein, and other nutrients causes measurable adverse effects on tissue and body form, function, and clinical outcome. It's a broad definition that can include both undernutrition, meaning not enough calories or protein, and paradoxically can coexist with obesity. A patient can be overweight but severely malnourished in terms of essential micronutrients and protein, a condition sometimes called sarcopenic obesity. The etiology of adult malnutrition is often related to one of three contexts: chronic disease, cancer, chronic obstructive pulmonary disease. Heart failure can increase metabolic demands while simultaneously decreasing appetite or impairing nutrient absorption. Acute illness or injury, sepsis, major surgery, trauma puts the body into a hypermetabolic, hypercatabolic state where it rapidly breaks down its own muscle tissue for energy, leading to a swift decline in nutritional status. Social and environmental factors, poverty, food insecurity, depression, dementia can also severely limit a person's ability to procure and prepare adequate food. The pathophysiology of malnutrition, particularly in the context of illness, involves a significant inflammatory response. The same inflammatory cytokines that we discussed in obesity and metabolic syndrome are released in response to illness or injury. These cytokines drive catabolism, the breakdown of body tissues, especially skeletal muscle. This leads to a loss of lean body mass, which is critical for strength, immune function, and recovery. This process is different from simple starvation, where the body adapts by slowing its metabolism. In illness-related malnutrition, the metabolism is actually accelerated, burning through energy and protein stores at an alarming rate. The manifestations of malnutrition can be subtle at first. You might notice a patient has a poor appetite, is eating less than 50% of their meals, or reports unintentional weight loss. As it progresses, you will see more obvious signs: loss of subcutaneous fat, muscle wasting, especially visible in the temples and clavicles, weakness, fatigue, and poor wound healing. A patient with a pressure injury that isn't healing may be suffering from underlying protein-calorie malnutrition. You may also observe edema in the extremities, which can be caused by low levels of albumin in the blood. Recognizing these signs early is a critical nursing function that can prevent a cascade of negative outcomes. The first step in addressing adult malnutrition is identifying it. As a nurse, you are on the front lines and will likely be the first person to spot the red flags. All patients should be screened for nutritional risk upon admission to a hospital or care facility using a validated screening tool such as the Malnutrition Screening Tool or MST. This simple tool asks 2 questions. Have you lost weight recently without trying? Have you been eating poorly because of a decreased appetite? A positive screen triggers a more in-depth nutritional assessment, often performed by a registered dietitian, but your initial screening is what gets the ball rolling. The goals of care for a malnourished patient are centered on repleting their nutrient stores, preserving or rebuilding lean body mass, and supporting their overall function and recovery. The primary goal is to provide adequate calories and, most importantly, adequate protein to stop the catabolic process and promote anabolism or building tissue. The specific goals will be individualized. For a post-operative patient, the goal might be to support wound healing. For a patient with cancer, it might be to maintain strength and tolerance to treatment. For an older adult, it might be to prevent falls and maintain independence. Interventions for malnutrition are tailored to the patient's ability to eat and the underlying cause. If the patient can eat, the strategy is food first. High-calorie, high-protein foods, smaller, more frequent meals. Oral nutritional supplements like Ensure or Boost, you will play a key role in encouraging intake. Assisting with meals, monitoring how much the patient is actually consuming. It's not enough to just place a tray in front of them. You need to document their intake and communicate any issues to the team. When oral intake is not possible or insufficient to meet the patient's needs, nutrition support is initiated. Enteral nutrition delivers a specialized liquid formula directly into the stomach or small intestine via a nasogastric tube, gastrostomy tube, jejunostomy tube. This is the preferred route if the gut is functional because it helps maintain gut integrity. If the gut works, use it. Parenteral nutrition delivers a specialized sterile solution of nutrients directly into the bloodstream through a central venous catheter. This is reserved for patients with a non-functional gastrointestinal tract. Managing these complex therapies includes monitoring for complications like aspiration with enteral nutrition or infection with parenteral nutrition and is a high-level nursing responsibility. As we conclude our deep dive into obesity, metabolic syndrome, adult malnutrition, it is clear that these conditions are not just isolated chapters in a textbook. They are deeply intertwined threads in the complex fabric of human health. Obesity is the primary driver for the cluster of risks known as metabolic syndrome, and yet a person with obesity can simultaneously suffer from critical malnutrition. Your ability as a future nurse to see these connections, to understand how one condition influences another, is what will elevate your practice from task-oriented to truly holistic and patient-centered. This integrated understanding is precisely what the NCLEX is designed to test your capacity for clinical judgment. Remember the key takeaways for each condition. For obesity, recognize it as a chronic disease, not a lifestyle choice, and focus your interventions on achievable health improvements beyond just the number on the scale. For metabolic syndrome, memorize the 5 criteria and think of it as a ticking clock, where your interventions are aimed at reducing the immediate risk of a catastrophic cardiovascular event or the onset of type 2 diabetes. For adult malnutrition, be a detective, always screening for this often hidden condition, knowing that adequate nutrition is the fuel your patient needs to heal from any illness or injury. Your role in managing these conditions is multifaceted and indispensable. You are the educator, translating complex medical information into practical advice your patients can follow. You are the assessor, using your sharp eyes and hands to detect the subtle signs of metabolic dysfunction or nutritional decline. You are the advocate, ensuring your patient receives the appropriate consultations with a dietitian, a physical therapist, or a social worker. You are the caregiver, managing complex medication regimens, tube feedings, and post-operative care with skill and compassion. You are the central hub of the healthcare team. As you move forward in your studies and into your career, carry this knowledge with you. Let it shape how you view every patient you care for. When you check a blood pressure, think about what it means in the context of metabolic syndrome. When you assist a patient with a meal, consider whether they are getting the protein they need to heal. This proactive, nutrition-focused mindset will not only help you excel on your exams, but will, more importantly, empower you to make a profound and lasting difference in the lives of your patients. You are entering a profession where your knowledge directly translates into better health outcomes, and understanding nutrition is one of the most powerful tools you will ever possess.